Hey everyone, Dr. Schaefer, physical therapist here with Chad Schaefer PT. I wanted to talk to you about a course that I took over the weekend, actually an online course prerequisite to the Part B of the McKenzie approach to the cervical spine. And what was really cool about this is it went over a lot of great details, and essentially just kind of starting off in the basics is sometimes what we forget as physical therapists. And essentially looking at how does the certain movement change a pain, and does it or does it not. In relation to this patient that I had specifically, she came in with upper back pain, some CT junction, so lower neck pain, as well as left shoulder pain. And the reason that these two things kind of melded together that was kind of cool was in the McKenzie course they talk about just posture correction. How does posture correction change your symptoms? And we all learned that it's not related specifically to the MDT or McKenzie principle, but sometimes we tend to forget the simplistic ways that we treat patients and just, hey, why don't you try to sit up straight and see what happens to your shoulder pain, your neck pain. In her case, it happened to be 2 days after I had done this online component, and I said, all right, let's just back off, go back to the basics. Let me correct this patient's posture because, she's sitting like this all day. Let's get you up nice and tall. I want you to sit there for 10 seconds and see how that changes your shoulder pain. Almost instantly, her shoulder pain dropped from an 8 out of 10 to a 2 out of 10. So already the patient's bought in, they're inspired, they want to get better, and instantly they can see results. So from there, we went and we checked out cervical traction or chin tuck, and most people are limited in that motion. And it happened to be that after we did about 2 to 3 sets of 10 of those motions, the pain went to a 1 and then to a 0 out of 10. So right away, in about 10-20 minutes, I told the patient, look, this is going to work for you. These are the motions that you need to do, and you're going to get better very fast. So I just wanted to make this video and talk about some of the simplistic things that, if we're going too hard, too fast, especially in relation to force progressions with McKenzie, or really any treatment approaches, back off and maybe use a different version of that. Instead of going into full retraction, try early range retraction or mid-range retraction. Same thing, see if it's going to create a clinical change in the patient's symptoms instead of doing what you've been doing and seeing if there's a change. So don't just do what you're used to. Try different things. Have an original thought to how you're going to treat this patient.